us here on Marketplace is Dr. Craig Bax from the Center of Prevention, Cure Chronic Disease, here to talk about preventative care and lowering your risk of chronic disease. So thanks so much for joining us.
Thank you.
Now, this is a topic that we talked about the last time you were here in relation to preventative care, but today you want to specifically focus on women and preventative care. Let's talk a little bit about that.
I think lost in the discussion about women's health is the fact that heart attacks and strokes kill more women every year than all the cancers of the breast, the uterus, the cervix, and other malignancies combined. And so women tend to think that heart disease is more of a man's disease. And prior to menopause, that's generally true. But as we get into those later years, the women catch up pretty quickly in terms of frequency. And one of the biggest problems is that the symptoms of heart attack, in particular in women, are rather different than they are for men. The book was written based on how men describe heart attacks. Heaviness in the chest, like something sitting on their chest, aching in the arms or the jaw. Women tend to have a different constellation of symptoms. I just don't feel right. Something's wrong. Sometimes it's confused with panic attacks or anxiety attacks and then written off. And if a woman doesn't know that they have underlying arterial disease, they may not be taken as seriously as they should. That's why women die of their heart attacks more frequently than men do when they are diagnosed. They slip through the cracks, and the diagnostic testing that's done often overlooks it. So we advocate that women should be screened for arterial disease and prediabetes at least as frequently as men, because knowing that it's present changes the way that the symptoms that they present with are dealt with.
So are there differences in care, in preventative care for men and women?
Not really that much.
Okay.
There may be some issues, controversy about hormone replacement therapy come into play, but by and large the same risk factors that affect men also affect women. High cholesterol, everybody knows about that, high blood pressure, family history, smoking, sedentary lifestyle. Diet, but particularly the diet issue that is overlooked is the overconsumption of sugar and carbohydrates, especially in processed foods, that lead to prediabetes and diabetes. And when we don't understand that role, we continue on a path that leads to the further progression of these diseases that ultimately culminate in a life-altering or life-threatening event.
So obviously choosing a healthier diet and lifestyle and making sure you're doing your routine testing are important factors to lowering your risk for women especially. And for more information, where can they go if they're wanting to sit down with you and kind of go over what they can do to lower their risk and making sure they're staying on top of these things?
Well, you can go to our website at thecenterforprevention.com, or you can call my office at 217-321-1987. We also have a weekly event on Tuesdays at 7 a.m. It's called Talking Cure over coffee. No obligation, no cost. It's just an informal discussion about what we offer. Okay. And then we repeat that in the afternoon at 5:15. We call it Talking Cure before dinner.
So a great opportunity to get all of your questions answered if you have any concerns and looking for some assistance.
Absolutely.
All right. Well, Dr. Bax, thank you so much for joining us here. Always a pleasure on News Channel 20 Marketplace. And we'll be right back on the other side of this break. Stay tuned.